In recent years, dozens of outbreaks have been associated with reuse of single-dose vials and misuse of multiple-dose vials. As a result, patients have suffered significant harms, including death. CDC's One and Only campaign urges healthcare providers to recognize the differences between single-dose and multi-dose vials, and to understand appropriate use of each container type. This information can save lives. A single-dose vial is approved for use on a single patient for a single procedure or injection. Single-dose vials typically lack an antimicrobial preservative, so do not save leftover medication from these vials, as harmful bacteria can grow and infect a patient. Discard single-dose vials after every use. A multi-dose vial is recognized by its FDA-approved label. Although multi-dose vials can be used for more than one patient when proper aseptic technique is followed, multi-dose vials should be dedicated to only one patient whenever possible. Multi-dose vials typically contain an antimicrobial preservative to help limit the growth of bacteria. Preservatives have no effect on bloodborne viruses such as hepatitis B, hepatitis C, or HIV. Size does not matter. Always check the label. Single-dose vials and multi-dose vials can come in any shape and size. Do not assume that a vial is single-dose or multi-dose based on size or volume of medication. Follow these injection safety steps for success. Before the procedure, carefully read the label. If it says single dose and it has already been accessed, throw it away. If it says multi-dose, double-check the expiration date and the beyond use date. See if it was previously opened, and inspect the vial to ensure there is no visible contamination. Remember, when in doubt, throw it out. During the procedure, use proper aseptic technique and always use a new needle and a new syringe each and every time the vial is accessed to withdraw medication. Clean your hands immediately before handling any medication. Disinfect the medication vial diaphragm with alcohol. Draw up all medications in a clean medication preparation area away from sinks and other possible sources of contamination. After the procedure, discard all used needles, syringes, and vials. At the end of the day, we're all patients. Knowing how to properly identify single-dose and multi-dose vials prevents infections and saves lives. Following basic safe injection procedures is not something to take for granted. There's too much at stake. Educate yourself and those around you. Do your part to make healthcare safe, one injection at a time. One needle, one syringe, only one time. Learn more about safe injection practices and download free resources at oneandonlycampaign.org.